In this chapter, we'll take a look at oral and dental health. So a little bit of an intro on why nutrition is so important. So diet and nutrition play a role in tooth development, the integrity of the gingiva or gums and the oral mucosa, looking at bone strength, and the prevention and management of diseases of the oral cavity. And so oral disease is important for one's nutrition, as again it can affect PO intake, including adequacy and the types of food eaten. And again, the other big thing, so I know we've talked about several times during our lectures, is looking at things like head and neck cancer programs. So again, how changes to the salivary glands due to radiation, right, can then affect a patient's intake and nutrition status. So looking at the anatomy and the physiology of the oral cavity, so you have the lips, which assist in directing food in the oral cavity. You have the palate, which allows for chewing, swallowing, and breathing to occur simultaneously, so that's the roof of your mouth. You have the tongue, which moves food from the front of the mouth to the pharynx in preparation for swallowing. And again, we obviously have the teeth, which again allows for mechanical breakdown of food through mastication. So again, with mastication, where our goals are to break food into smaller pieces, mix the food with saliva, and stimulate the taste buds. So looking at nutrition for tooth development, so we know that maternal nutrition affects tooth development during gestation, and primary tooth development begins at 2 to 3 months gestation, with mineralization beginning at 4 months gestation and continuing through preteen years. Now looking at the composition of teeth, so you have the dentin, which is the main component of teeth, and this is composed of collagen, hydroxyapatite, and water. And so again, remember hydroxyapatite, this is a similar crystalline structure to the bone. So this requires vitamin D for crystallization, and then again here you have this crystalline structure of calcium and phosphorus. And again, that collagen, that actual protein layer, which again requires vitamin C for synthesis. Now we have the enamel, which covers the dentin, which also contains hydroxyapatite, but does not contain collagen. And so then we'll talk about hydroxyapatite with fluoride, which then makes actually fluoroapatite, which provides dental carie resistant properties to the outer covering of the teeth. So here you can see the structure where, again, what we're really trying to protect is that enamel is this layer that's going to protect the dentin, and then underneath that you have the pulp. And again, remember that obviously there are blood vessels, as you can tell, and there's a lot of nerves, thus the pain that you get or toothaches. So looking at dental caries or tooth decay, so oral infectious disease in which organic acid metabolites lead to the gradual demineralization of tooth enamel, followed by rapid proteolytic destruction of the tooth surface. Now it can occur on any tooth surface, but there's some common areas. This is one of those common infectious diseases, with 20 to 25% of children having 80% of the dental caries. And so CDC evidence demonstrates children from homes in which parents have at least a college education have fewer cavities, and a lack of access to care, cost of the care not being reimbursed by third-party payers, and a lack of knowledge of preventative dental care being the contributing factors to these dental caries. So for cavities to occur, 4 factors must be present. So we need a susceptible host or tooth surface, microorganisms in the dental plaque or oral cavity, fermentable carbohydrates in the diet which serve as substrate for the bacteria, and time in the mouth for bacteria to metabolize the fermentable carbohydrates, produce acids, and drop the salivary pH to less than 5.5. So again, here what we're going to see, and so the concern here is that, again, over time, in essence, is that this acid is going to eat through the enamel into the tooth. So we need a susceptible tooth, so this is one that's vulnerable to attack. And so factors that determine susceptibility include the composition of enamel and dentin, so again looking at your lifelong diet, and so again looking at what the exact crystalline structure of that enamel. We're looking at the location of the teeth, so it's more likely that they'll occur in the molars, which are harder to brush further back. The quality and quantity of saliva, as alkaline saliva has a protective effect, while acidic saliva increases susceptibility to decay. And the presence and extent of pits and fissures in the tooth crown. So again, little nooks and crannies that again makes it more difficult for the brush to get to and allows the bacteria to sit on the tooth surface for long periods of time. Now again, this is actually from a bacteria, which then as a byproduct produces acid. And in this case, we're looking at Streptococcus mutans is the most prevalent bacteria. And so what it does is it does what all bacteria do, which is they metabolize carbohydrates, but they produce acid as a byproduct, right? This is the same thing when you make yogurt and you have bacteria and the yogurt turns sour because there's acid in it. This is the same thing, but instead of eating lactose, these bacteria are eating carbohydrates in your mouth and then producing acid. And so this acidic environment is conducive to tooth decay. Now, genetic factors may contribute to the type and quantity present in the oral cavity. So again, some people have more, some people have less bacteria. And the quantity and quality of oral hygiene contributes directly to the risk of oral infectious disease, which is brushing your teeth frequently, right? Making sure that we're removing the carbohydrates and the bacteria from the surface of the teeth, right? Obviously plays a role in the likelihood of developing cavities. Now again, looking at this substrate, so what's necessary for this to occur is fermentable carbohydrates. So carbohydrates that are susceptible to actions of salivary amylase. So this is the ideal substrate for bacterial metabolism. And so again, when these bacteria metabolize carbs, they produce acids and drop the salivary pH to less than 5.5, which is ideal for tooth decay. And these are, of course, your obvious carbs like grains, fruits, and dairy. So one thing we have to look at is karyogenicity, which is the carie-promoting properties of a food, or what kinds of foods, or what makes a food more likely to cause a cavity. So the karyogenicity of a food depends on the form in which it occurs, the nutrient composition, when it is eaten in relation to other foods and fluids, the duration of its exposure to the tooth, and the frequency with which it is eaten. So karyogenic foods are things that are more likely to cause cavities. This is grains like breads, crackers, pretzels, chips, and cereals. All fruits forms, whether they be fresh, dried, or canned. Now, the higher the water content, though, the lower the karyogenicity. Sodas, sweet teas, juices, and other sugar-sweetened beverages. Desserts, cookies, candies, and cake. And all dietary forms of sugar have karyogenic potential, including sugar, honey, molasses, brown sugar, and corn syrup. And dairy products sweetened with fructose, sucrose, or other sugars can be karyogenic. However, they are rich in calcium and alkaline properties, may have a positive effect by reducing the karyogenicity. So unsweetened dairy, right, of course, is going to be much better for your teeth than, for example, chocolate milk. So karyogenic foods are going to lower the oral pH to less than 5.5, and this is due to their fermentable carbohydrates. Karyostatic foods are going to have no effect, or they're going to remain static on pH. And so then this is going to be protein foods, so this is your meat, fish, poultry, eggs, and vegetables. Sugarless gums, right, can reduce the potential for decay. And then we also have our anti-karyogenic foods, and these raise the oral pH and help prevent decay. And so when eaten before a karyogenic food, this can prevent plaque from recognizing the karyogenic food, right, or having access to those carbs. This is things like aged cheese, which contain casein, calcium, and phosphate. And you'll notice that aged cheeses are, and almost all of them are actually, is carb-free, right? This is kind of the big craze you'll see with the keto diet. So again, you're looking at those aged cheeses that don't have carbohydrates in them. And xylitol gum, right? So again, salivary amylase can't break it down, and it's not susceptible to bacterial degradation. So again, here we have our examples of karyogenic, karyostatic, and then anti-karyogenic. And so to give you an example, right, ideally what we would see if you're trying to care for your teeth. And so the biggest thing is, right, if we want to brush our teeth after breakfast and before bed. And then, right, so having it after lunch or after the snack, right, the xylitol gum, which helps prevent the bacteria, right, so what it does is it helps increase salivation, which then rinses off the teeth and then reduces the risk that the carbohydrates will sit on the teeth and cause cavities. Now, other concepts to consider when it comes to protecting these cavities, so remineralization, and so here we're looking at the mineral restoration of the hydroxyapatite in dental enamel. And so this is casein phosphopeptide amorphous calcium phosphate, or CPP-ACP. And this promotes the remineralization of the enamel surfaces. And so this is a specific brand of Trident. Trident white gum actually has this. And so it has been shown to have anti-karyogenic activity in clinical trials. Now again, looking at some of those other factors that go into the karyogenicity of the foods. So again, we talked about food form and consistency. So form determines the duration of exposure of a food in the mouth. So liquids are rapidly cleared from the mouth and have poor adherence capability, whereas some solid foods such as crackers, cookies, or chips can stick between the teeth and have higher adherence capability. So you've seen this if you've ever gotten, especially in the crown of the tooth, or you can feel like there's just like you can feel like the pretzel's just stuck on the surface of your tooth. Again, that's increasing your risk of cavities. Consistency also affects adherence. So chewy foods such as gumdrops or marshmallows, again, these stimulate saliva production and have lower adherence than more solid sticky foods, again, like pretzels, bagels, bananas. If you ever had the candies that really get stuck in your teeth, right, those are the ones that we're really concerned about. Now looking at exposure or duration, so the longer starches are retained in the mouth, the greater their karyogenicity. So again, this is where if you have like jawbreakers that just sit in your mouth next to your teeth for hours on end, that's very bad for your teeth. Simple carbohydrate-based snacks such as chips or pretzels provide gradually increasing oral sugar concentrations for a long duration because, again, they adhere to the tooth surface and are retained in the mouth for longer periods of time. Again, we said looking at nutrient composition. So dairy products containing calcium and phosphorus have lower karyogenic potential. So cheese and milk help to buffer the acidic pH when consumed with a karyogenic food. And nuts, protein foods, and fats are karyostatic. We also have to look at the sequence and frequency of eating. So a decline in pH is initiated within 5 to 15 minutes after consuming a fermentable carbohydrate. So for example, if we were to drink milk after eating a banana, right, this would then help reverse that and make the oral pH more alkaline and help protect the teeth. So looking at the decay process, so bacterial metabolism produces acids, we said, as a byproduct. And again, this is what causes the decalcification of the enamel until the buffering action of the saliva is able to raise the pH. Now again, what we said is we're going to actually eat through the enamel and then we're actually damaging the protein layer underneath. Now we do have what's known as plaque, and so this is sticky, colorless mass of microorganisms and polysaccharides that forms around the tooth and adheres to the teeth and gums. And so this can block the decayed tooth from the buffering and remineralization action of saliva. Now you've actually probably had plaque before, which is if you ever had that like filmy stuff on your teeth that you scrape off and then your teeth feel normal again. Now the concern is that plaque can combine with calcium and harden to form calculus, and this is calculus or tartar is hardened plaque. And so again, this is caused by the continual accumulation of minerals from the saliva with the plaque on the teeth. Now plaque you can remove with a toothbrush, whereas tartar or calculus has to be removed with dental picks. Now plaque formation does require an acidic pH. Now we also take into consideration the acidity of beverages. So the high acid content foods are things like sports drinks, citrus juices, diet sodas, your lemonades, your orangeades, your limeades, and vitamin C supplements. And so the NHANES data reported more dental caries in children aged 2 to 10 years of age who consumed large amounts of carbonated soft drinks or juices when compared with children who had high consumption of water or milk. Now looking at the dental erosion, so again a loss of minerals from tooth surfaces by a chemical process in the presence of an acid. Now diet soft drinks are acidic in nature even though they do not contain sugar, so they're still bad for your teeth. Not as bad as soft drinks which also have sugar and the acidity, but diet soft drinks are still bad for your teeth. And chewable vitamin C supplements can cause an acidic environment, making the teeth more susceptible to erosion. So again, recommendations to prevent dental caries includes brushing your teeth twice a day, rinsing the mouth after meals and snacks, chewing sugarless gum for 15 to 20 minutes after meals and snacks, flossing twice daily, using fluoridated toothpaste, pairing karyogenic foods with karyostatic foods, snacking on karyostatic and anti-karyogenic foods, and limiting between meal eating and drinking of fermentable carbohydrates. Now looking at the saliva, so again this is the primary oral cavity secretion produced by the salivary glands. And so humans produce on average 1 to 2 liters of saliva per day. So if anyone's ever cut weight for wrestling, you'll know that doesn't surprise you. But I think some people find that surprising, right? That is a lot of saliva. And so again, it's made of 99.5% water, but it also has some electrolytes, including calcium, phosphorus, and fluoride, and small amounts of protein. So we have Lysozyme functions as the first part of our immune defense by destroying bacteria in the mouth. And chewing does promote saliva production, so the eating food then produces more saliva. So looking a little bit about the AMP of it, so the functions of saliva is that it moistens and lubricates food to facilitate swallowing. It initiates the digestion of carbohydrate via salivary amylase. Again, we discussed the antibacterial protection with lysozyme. It enhances taste by providing a solution that can interact with the taste buds. It serves as a buffer to neutralize acid and protect the teeth from dental caries. Also participates in oral hygiene by dissolving food, dead cells, and foreign substances, and assists with speech by allowing free movement of the lips and tongue. So conditions that can result in altered salivary gland function. So we have xerostomia, which is dryness of the mouth caused by a cessation of normal salivary secretion. And this may result as a condition of disease process, as a medication side effect, or due to radiation treatments. Other causes include infection, damage to salivary glands, and again, that radiation damage can be affecting long-term normal saliva production. Also, you have things or disease processes like Sjogren's syndrome, which is an immunological disorder characterized by deficient moisture production of the salivary and other glands, resulting in dryness of the mouth, eyes, and other mucous membranes. Medications that can cause dry mouth include anti-anxiety agents, anticonvulsants, antidepressants, antihistamines, antihypertensive, diuretics, narcotics, sedatives, serotonin reuptake inhibitors, and tranquilizers. And so again, we had to look at those causes. So again, looking at medications, disease processes, radiation treatments, chemotherapy, and nerve damage. So nutrition interventions for dry mouth. So tart foods may stimulate saliva. We recommend sipping on liquids or sucking on ice chips throughout the day, avoiding caffeine, alcohol, and tobacco, trying a cool mist humidifier at night, rinsing the mouth frequently with mild saline solution, adding extra sauces and gravies to foods, and avoiding dry, crumbly, chewy, and sticky foods. Now looking at dental carie patterns. So we do have what's known as root caries, which occur on the root surface of the teeth due to gingival recession. This is often found in the older population due to the gums receding with age, exposing the root surface. Then we also have the lingual caries, which are the caries on the lingual side next to the tongue of the anterior teeth. This is seen with typically GERD, bulimia, and anorexia nervosa with the binging and purging subtype. And again, this is due to regurgitation or induced vomiting. So again, an acid is eating away at the enamel in a specific location. Now looking at fluoride. So we know that fluoride is a safe and effective public health measure to reduce the incidence and prevalence of dental caries. And fluoridated water began in the 1940s and has decreased the rate of dental caries. Now we do need to take a look at it. So the optimal water fluoridation concentrations are at 0.7 to 1.2 parts per million. And we also have toothpaste, oral rinses, gels, and dentifrice, which is the powder for polishing. Now, in communities without fluoridated water, supplementation may be recommended for children from 6 months to 16 years of age. So after that, right, basically after the crystallization is done with the teeth, there's not as much benefit. And no supplementation is needed if you're drinking appropriately fluoridated water. So if you're drinking any city water or municipal water, there's a very, very high likelihood it is fluoridated. Now again, so how does this work? So it does form fluoroapatite, which is more resistant to acid than hydroxyapatite. It helps promote the repair and remineralization of the tooth surface. It can help reverse the decay process while promoting the development of a tooth surface that has increased resistance to decay. And it can help to deter the harmful effects of bacteria in the oral cavity by interfering with the formation and function of microorganisms. Now looking at the food sources, so most foods contain minimal amounts of fluoride, although brewed tea actually has 1.4 parts per million. Bone meals, fish meal, and gelatin made from bones will contain some fluoride. Fluoridated water may be used in the processing of foods and beverages. So again, if you're making soup and you use water, right, it's going to have fluoride in it. And fruit juices and drinks that are produced in cities with fluoridated water, again, we know this from food manufacturing is they just use municipal water. So again, if you're getting, for example, a cranberry juice cocktail, which is watered down cranberry juice, it's going to contain fluoridated water. Now, the one criticism, right, is that it's difficult to estimate the total amount consumed in the diet because, again, you don't know the exact amount in the ocean spray cranberry juice and in the soup you made and in the toothpaste you used and in the water you drank. So that's kind of one of the only criticisms is that we just don't have all the information from other sources like food manufacturers. So looking at supplementation, and so again, the fluoride that you're getting in your toothpaste is and in like the mouthwashes is in very, very low amounts, although there is actual fluoride supplementation, and this has to be prescribed right by a healthcare provider. This is not the OTC equivalent. So again, if this is determined to be appropriate, right, then we have to consider the child's fluid intake, food sources, and availability of fluoridated water in the community before they receive the fluoride supplement. This can be used topically or systemically, so especially when they're younger, before the tooth erupts, the fluoride actually begins being incorporated into the tooth. And so a supplement's not recommended for formula-fed or breastfed infants living in fluoridated communities if they drink water between feedings. And if they are breastfed and drink only bottled water, then it may be recommended. Now, one of these side effects, so if we're getting excessive amounts of fluoride, as you'll see, is fluorosis. And this occurs when there's too much fluoride during tooth development, and it can be mild or severe. And again, it can be unnoticeable to darker spots on the teeth. So children under the age of 6 should not use fluoridated mouthwash. And again, children should be using small amounts of toothpaste and be instructed not to swallow the mouthwash or toothpaste. And fluoride is most effective when given from birth through ages 12 to 13 years. And adults are often prescribed fluoride gels to reduce the risk of tooth decay and tooth loss. So especially if you're at high risk or you're having damage, they'll give you fluoride. But in essence, fluoride is one of those things where an ounce of prevention is worth a pound of cure, where it really needs to be incorporated early on to see the most benefit. Now looking at early childhood caries, so we do have what's known as baby bottle tooth decay. And so this is a dental carie pattern in the front teeth of infants and young children. And this is caused by prolonged bottle feeding of juice, milk, formula, and other sweetened beverages, especially at night, and this is usually due to the child falling asleep with a bottle. And so management includes educating the caregiver on proper oral hygiene, brushing the teeth daily, removal of the bedtime bottle from the routine, using the fluoridated water, and weaning the bottle by 1 year of age, and a first dental exam should be done at 1 year of age in children. So here you can see that specific pattern where, again, you can see this is from the actual nipple on the bottle, again with a sugar-sweetened beverage or a high carbohydrate-containing beverage, damaging the teeth. So again, overall, looking at dental carie prevention, so a balanced diet with modification of the sources and amounts of fermentable carbohydrates, good oral hygiene, snacking on karyostatic foods, chewing sugarless gum after eating or drinking karyogenic foods, consuming sweets with meals instead of as a separate snack, avoiding sucking on hard candy or breath mints that are made with sugar. So again, sugar-free is okay, but like jawbreakers and sitting them in your cheek is very damaging. And avoid sipping on soda or sweetened juices for extended periods of time. So looking at tooth loss and dentures, so we do have patients who are edentulous or edentialism, which is without teeth, and they will obviously have difficulty chewing. And so dental caries and edentialism or tooth loss and ill-fitting dentures all contribute to nutrition risk. And so obviously with inadequate intake of nutrients, so again this affects food choices, especially fruits, vegetables, whole grains, and some meats, as it could be too difficult for the patient to chew or too painful to chew. This can of course lead to malnutrition and weight loss. And again, what we see is about a 5% weight loss. You'll see a significant change in the fit of dentures. So when an older person loses weight, it will actually change the size of their gingiva, their gums, and then their dentures don't fit, so then they don't wear them, then they don't eat, and the weight loss gets even worse. So management includes ensuring the dentures fit properly, encouraging oral health and hygiene. Patients may need their food cut up smaller to make chewing easier. Foods can be prepared differently to make chewing easier. This is things like cube steaks. This is things like ground meats, like meatloaf as opposed to steak, etc. But again, a still balanced diet, so without avoiding food groups. So if we need to cook vegetables until they're more tender, if we need to do things with fruits like sweating them or other things to make them softer, etc. Now, questions to assess for chewing ability. So if you suspect a patient is having issues, this is something you want to identify. We have to find ways to weave into our interview process. Do you have any difficulty chewing? Is it painful for you to chew? Are there any particular foods that are giving you trouble? Do you avoid any foods completely because you can't chew them? Do you wear dentures? Do you have them with you? Do they fit? Have you lost any weight recently? Would you like any of your foods chopped, ground, or pureed, etc.? Other oral disorders and things to be concerned with. We have vitamin deficiencies with things like riboflavin, folate, B12, and C. Mineral deficiencies with iron and zinc. Again, we said with eating disorders, we have demineralization of the teeth due to repeated exposure of acids in the form of stomach acid. Oral cancer, oral surgeries, radiation therapy, chemotherapy, and periodontal disease. So looking at periodontal disease, so this is inflammation of the gingiva or gums, aka gingivitis, right? As the Listerine commercials would tell you, the gum disease gingivitis. What you come to find out is just inflammation of the gums. So again, this is with an infection caused by oral bacteria. Now the problem is that mild irritation of the gums can happen with certain foods, etc. But our big concern here is that if we have a serious infection or inflammation of the gums, is it can actually get into the root of the tooth where it's actually attached to the jawbone. And so then that infection can be quite severe. So plaque is the primary cause, and the progression of periodontal disease can be influenced by oral hygiene, integrity of the immune system, and nutrition status. So folate, vitamin C, and zinc deficiencies can increase permeability of the gingival barrier at the gingival sulcus. And so it's the shallow V-shaped space around the tooth. So this is where you're actually supposed to, quote unquote, brush below the gum line, or you're supposed to floss below the gum line. And so that's actually, there's a tiny little space there, and that's where the bacteria and the plaque can build up. So we want to make sure that we remove that. So vitamin C deficiency, or scurvy, right, is a form of periodontal disease which can cause deterioration of the gums and bleeding. And we do see an inverse relationship with dairy intake of calcium and phosphorus and decreased incidence of periodontal disease. So people that aren't getting a lot of dairy or a lot of calcium and phosphorus are at a higher risk of getting periodontal disease. Now, severe periodontal disease may be treated surgically, and adequate nutrients before and after surgery are needed to help regenerate tissue, support immunity, and prevent infection. And oral supplements and a modified diet consistency may be needed. So if the surgery is bad enough and the mouth pain is bad enough, right, we may need to use softer foods, supplements, etc. Looking at surgical procedures for the oral cavity. So surgical resections of the tongue, palate, or pharynx for head or neck malignancies. Patients may have tonsillectomies and adenoidectomies, so the TNA procedure. You may have patients who have had a fracture or repair of the jaw to an accident or trauma, and so you'll see the term ORIF, or open reduction internal fixation, which is a real fancy way of saying they wired their jaw. So what you're looking for is an open reduction, which is they had to do the surgery and they had to put the jaw back into place, and then they placed an internal fixation device, which is the wires to hold everything in place. External fixation is when you have things outside of your body, like a halo, for a neck surgery. So this is inside the body or inside the mouth. So again, the broken jaw is reduced and put back into place, and again, the internal fixation is placed on the bone, including screws, plates, rods, or pins. Now looking at the diet for oral surgeries, this could be blenderized or pureed foods, enteral nutrition, liquid supplements, a liquid multivitamin, again, foods or liquids given through a straw or syringe, and the biggest thing is looking at hydration status to make sure that patients are maintaining their liquid intake. Now again, so we talked about inflammatory conditions of the oral cavity, so we have gingivitis, which is inflammation of the gums. We have stomatitis, which is inflammation of the oral mucosa. So this is where we have open ulcerations, or you also hear this referred to as mucositis, which is inflammation of the mucous membranes. We have glossitis, which is increased redness, swelling, and pain of the tongue and lips. We have chelosis, which is scaling and fissuring at the corners or angles of the mouth. And so again, both glossitis and chelation are types of inflammation of the oral cavity, most commonly associated with vitamin deficiencies, including niacin, riboflavin, and pyridoxine. So looking at oral manifestations for diabetes. So during periods of poor glucose control, patients may have burning mouth syndrome, periodontal disease, candidiasis, dental caries, and dry mouth. And tooth infections are more common in patients with diabetes. Looking at oral manifestations of fungal infections. So fungal infections may cause burning, painful mouth, and dysphagia. Viral infections such as herpes simplex may be accompanied by ulcers, pain, and reduced oral intake. And we recommend that very hot and very cold foods, spices, sour and tart foods be avoided. And patients may benefit from high-calorie, high-protein PO supplements in a liquid or pudding form to increase intake. Looking at the oral manifestations of head and neck cancers. Surgery may alter eating or swallowing ability, as well as the ability to produce saliva. And radiation and chemotherapy can affect quantity and quality of saliva production and the integrity of the oral mucosa. Again, xerostomia is very common, so we recommend that these patients avoid crumbly, dry, chewy, and sticky foods, and they may need modifications for foods and beverages, and it's very likely that they will need nutrition support. Looking at the oral manifestations for HIV/AIDS patients. So viral and fungal infections, stomatitis, xerostomia, periodontal disease, and Kaposi's sarcoma are all common and lead to decreased PO intake. We're also likely to see a compromised immune system with pre-existing malnutrition and GI issues. Stomatitis and candidiasis are common, and again, this is a patient population that is very likely to need oral supplements. Now, along with intake, we also take a look at taste. So with impaired taste, so we have dysgeusia, so we have our altered or impaired sense of taste, and ageusia, which is the inability or no taste or mouth blindness. Now, again, this can be caused by chemotherapy, a radiation, side effect of medication, or a disease of the tongue or palate. And so again, different medications will cause different tastes. So we talked some about this in the food and drug nutrient interaction chapter. But again, just as a reminder, for example, drugs like methotrexate can cause a metallic taste. Zinc deficiency can also cause a loss or altered taste sensation. So again, as a review, we recommend fluoride and dental sealants and nutrition choices that can help with dental disease as high fiber foods, avoiding added sugar, rinsing the mouth after eating, sugarless gum with xylitol, avoiding high sugar beverages, and practicing good oral hygiene. So let's take a look at some practice questions. So one of the main factors in foods that make them cariogenic is, and this is A, fermentable carbohydrates. Number 2, a substance that is protective against dental caries. And this is answer choice C, fluoride. Periodontal disease is more likely to occur in individuals who have deficiencies of, and this is answer choice B, vitamin C, folate, and zinc. Dental caries are most common in, and this is answer choice B, low-income families. And lastly, a common side effect of radiation therapy to the head and neck is, and this is answer choice D, dry mouth. Thank you for your time, and I look forward to your questions.